So now let's talk about diving precautions and prevention of diving injury. Mainly, it will talk about what should we do to prevent the compression sickness, the gas embolism when diving. As you can understand from the beginning, we will talk about how slowly you should descend and who should not be dive because of contraindications. So you can see the safety precaution first. You can see that is giving recommendation on what should be do. You need to try to equalize the air spaces using a blowing out of air from nose into mask and yawing to stabilize and equalize the middle ear with the Eustachian tube using Valsalva maneuvers. Not holding your breath when you are ascending and ascending not faster than those values. Um, okay. Also, there is a recommendation to do a stop at for 3 to 5 minutes at around 4 meters, again to equilibrize. And there is no stop dive when you are not diving too much and too long, based on table in the tables, and there is dive that you need to stop for the compression stops. So there is also the idea of flying after diving. This is dangerous. So there are guidelines if you did a dive without no stop, without I mean with no stop dive, without no stop. I mean you don't need stop dive if this is the dive you did. Therefore, you can fly 2 hours, 12 hours after the diving. And if you did had a stop that you should have taken with your diving, so you will need to wait longer till you can fly around 18 to 24 hours until you can get on a flight. So um, there are things that can do complications, and you can see them here. Note the cold temperature, we can cause hypothermia, and in extreme cases can cause arrhythmias. And note the use of sedatives, alcohol, illegal drugs, so you can take those with diving. Diving alone is not recommended. If something happens, it's better that you are with someone. Okay, and be aware of the hypothermia. So now there are contraindications for diving. If you are not, if you have problems with your cardiopulmonary system, if you don't have enough aerobic exercise, if you have mental problems, you will not be able to dive. And there is even a table that states all the things: lung disorders, cardiovascular, with the shunts, psychological disorder, all of this can't dive. It's mainly contraindications for diving. Structural disorder, hernias, neurological disorders, seizures, and recurrent syncope, metabolic like diabetes that is based on insulin use, extreme obesity, ENT like perforated hepatic membrane, upper respiratory tract infection with congestion. It will prevent you from equalizing the pressure, and you can do a bowel trauma to your ear. Untreated allergic rhinitis, because again it can cause congestion and problems with equalizing the pressure. Pregnancy can cause birth defects and injury because of decompression sickness to the baby. Gastrointestinal overinflation, poor exercise tolerance, severe GERD, gastroesophageal reflux disease, and the children because they are not physical or physiological or understanding, they don't have the understanding probably. So you can see lung, cardiovascular, psychological, structural, neurological, metabolic, ENT, pregnancy, habitual, poor exercise, severe GERD, and children. Those in this are the details. Which types of diseases uh, can't die? Patients with this disease, well, let's say at least in a problem to die, they need to be cautioned. But this is based on Merck, a table of contraindications for diving. Contraindications. Okay, so that's it. This was about diving precautions and prevention of diving injury for Mac Manual Professional Edition. If there are any mistakes or correction, please correct me, and that's it.